Very good evening to all. In this today's topic of pediatrics, we'll be discussing antenatal screening in brief. The few MCQs in antenatal screening, which are very much pertinent for pediatrics. So you not only be expected what are the enzyme or hormones which you are able to get in order to detect whether a patient is having any antenatal genetic disorder or not. But in addition to this, we'll also try to focus on few specific ultrasonographic findings in the fetus which can point towards aneuploidy or for that matter any other abnormality pertaining to genetics other than aneuploidy as well. So we start with the question and then we discuss the topic in depth. So here the question is regarding the quadruple screening for antenatal diagnosis of genetic condition includes all except. As the name itself indicates, quadruple screening means there are four things which are tested in this particular screening technique where a alteration in the values of these things will result in some abnormal genetic condition which can be predicted accordingly. So it may be aneuploidy like trisomy 18 or trisomy 21 or any other aneuploidy related genetic condition. So what are the components of quadruple screen? So when I talk about quadruple screen, I should have four components. So the four components of the quadruple screen includes not only HCG, alpha fetoprotein levels. Quadruple screen for antenatal diagnosis includes all of the following except. So the options are HCG, alpha fetoprotein levels. The quadruple screen for antenatal diagnosis of genetic condition includes all except. So the options are HCG, alpha fetoprotein, estriol, and inhibin B. So which of them is not a component of quadruple screening? So if you look into the options or the four components of quadruple screen, the four components of quadruple screen includes number one HCG, number two alpha fetoprotein, number three estriol, number four is inhibin A and not inhibin B. So the answer for this question would be answer D, that is inhibin B. So inhibin B is not a component of quadruple screen. In fact, it is the inhibin A which is a component of quadruple screen. So this brings us to a topic called prenatal diagnosis, where we are using various non-invasive as well as invasive procedures for the prenatal diagnosis of various chromosomal disorders. Now, not all non-invasive or invasive tests are done during first trimesters or second trimester or third trimester. So few specific tests are done only in first trimester, few of them are done in second trimester, and few of them are done in third trimester. Depending upon what tests are being done in first, second, or third trimester, you are going to have the test labeled accordingly. For example, if you want to look at the circulating fetal DNAs, those that particular circulating fetal DNA, though it is a least specific test for assessment of chromosomal abnormalities, can be performed right from the first trimester to the second trimester. So, and so is the circulating fetal cells. It is the non-invasive serum screening, which is like triple screening, quadruple screening, which is going to be performed at the end of the first trimester or the beginning of the second trimester. So the triple screening is predominantly done in the first trimester, whereas quadruple screening is predominantly done in the second trimester. So this is the non-invasive test screening. So the MCQs which we can expect is what is the ideal time when triple screening is performed? What is the ideal time when the quadruple screening is performed? When it comes to invasive procedures, you are expected to know what is the invasive procedures which are going to be done for the diagnosis of a neonate or a fetus with chromosomal abnormalities. One is CVS, that is chorionic villus sampling, and other one is amniocentesis. Now remember, chorionic venous sampling is typically done between 10 to 12 weeks of intrauterine life, whereas amniocentesis is done between 15 to 20 weeks of intrauterine life. So this is what you will have to remember pertaining to prenatal diagnosis. So the invasive investigations which are done for prenatal diagnosis of a chromosomal disorder includes CVS and amniocentesis. The chorionic villus sampling is typically performed between 10 to 12 weeks of intrauterine life. Some books state that it is between 10 to 15 weeks, but 10 to 12 weeks is a general answer which is expected in the MCQs. And then we have amniocentesis. Amniocentesis is typically performed between 15 to 20 weeks of intrauterine life. Okay, then questions comes revolving around what is triple screen and what is quadruple screen. I have already told you quadruple screen includes HCG, alpha fetoprotein, estriol, and inhibin A. The quadruple screen, when it contains four things, triple screen will contain at least three components out of the four components of quad screen. So this is in brief. Whenever you want to screen the maternal serum for chromosomal abnormalities, the triple screen includes HCG, AFP, estriol. To this triple screening, if you add inhibin A, then it becomes quadruple screening. So when you use triple screening, the detection rate is only and only 70%, but when you use quadruple test, the detection rate is going to be 80%. That means quadruple screen is going to be a little bit more robust when compared to that of triple screen, and triple screen is predominantly performed in the later part of the first trimester, whereas the quadruple screen is performed in the second trimester. So coming back to the question, quadruple screening for antenatal diagnosis of genetic test is performed including all four except inhibin inhibin B. So we move to the next question. So highest detection rate is with which of the antenatal screening test? Is it combined test? It is quad screen test, or a triple screen test, or an integrated test? So now this question will try to understand what else you know about the antenatal screening other than triple screen and quad screen. So you need to know what is combined test and what is integrated test, in addition to what is quad screen and what is triple screen. So we know that the detection rate of quad screen is 80%. We know that the detection rate of triple screen is 70%. So what else are we interested in knowing? We are interested in knowing the detection rates of combined test and the detection rates of integrated test. So by what is integrated test? Is integrated test is a test which integrates a combined test along with a quadruple test. So what is combined test and how it is integrated in quad test and when it is performed will be helpful to us to know how efficiently the integrated test can perform. So when an integrated test is a combination of a quad screen and a combined test, which where combined test is performed in the first trimester and a quad screen is performed in the second trimester, the integrated test will have a higher detection rate of as high as 85%, and hence fetching the answer as D. Now, if you look into the table of quad screen, combined screen, and integrated test, this table will summarize everything for you. A combined test is a test which includes detection of pre-beta HCG, pregnancy associated plasma protein A, and nuchal thickness. Nuchal thickness. Now, if nuchal thickness is more than 6 mm, if pre-beta HCG and pregnancy associated plasma proteins are abnormal, and if this abnormality is detected in first trimester, then you have something called as a detection rate of 85%. Detection rate of 85%. When you use quadruple test, which is a second trimester screening technique using the maternal serum alpha protein, estriol, HCG, and inhibin, you have a detection rate of 81%. But when you perform an integrated test, that is a combined quadruple test as a combined test, combined quadruple test and a combined test. That means you combine combined test with quadruple test, then you get integrated test. So this will have a highest detection rate of up to 95%. Whether it is combined test, quadruple test, or an integrated test, the prevalence of false positive rate is constant. It is around 5%. It is around 5%. So this is about quad screen, combined test, and integrated test. The next question is regarding Down syndrome is characterized by all except. Is it high human chorionic gonadotropin, low alpha fetoprotein, low estriol, and low inhibin? So what do you think is a problem with Down syndrome except? Now, whenever you are performing prenatal screening, the most common aneuploidy which you are going to detect on this quadruple screening is nothing but Down syndrome. So Down syndrome and Edwards syndrome are the two common abnormalities or aneuploidies which you are going to find out on prenatal screening, especially quad test. Now, you know that quad test includes HCG, alpha fetoprotein, estriol, as well as inhibin A. Now, when it is involving all these four things, now whether it increases or decreases will have an implication on our understanding about Down syndrome and Edwards syndrome. So it is well known fact that in Down syndrome, two things are high, rest of them are low. When I tell it as high, HCG is going to be high and inhibin A is going to be high. The H stands for HCG, I stands for inhibin. Both of them are going to be high and AFP and estriol are going to be paradoxically low. That will establish the diagnosis of Down syndrome. Now when it comes to Edwards syndrome, all these parameters, whether it is HCG, alpha fetoprotein levels, estriol or inhibin A, all of them are going to be low. So this is nothing but Down syndrome and Edwards syndrome for you. So all four are low, point towards Edwards syndrome. All four are not low, few are high and few are low, will make you think towards Down syndrome. And here HCG and inhibin A are going to rise, whereas alpha fetoprotein and estriol are going to fall. So this is nothing but quadruple screen findings in Down syndrome and Edwards syndrome. So low inhibin A is not a feature of Down syndrome. So we go to the last question. Sorry, for the importance of this quad screen is, in a Down syndrome patient, HCG and inhibin is going to be high. As I told you, you remember the mnemonic HI remains high in Down syndrome. HI remains high in Down syndrome. What about Edwards syndrome? Everything is low. Everything is low. Everything is low. So this is about the Down syndrome. What are the ultrasound markers of Down syndrome apart from these four hormonal imbalances? So the other aspects of Down syndrome includes increased nuchal translucency. A nuchal pad thickness of more than 6 mm by at 15th week of intrauterine life. Short femur and humerus length, duodenal atresia, and absent nasal bone. All these are going to be ultrasound markers which can be pointing towards Down syndrome. So we go to the next question. Conditions which are associated with reduced alpha fetoprotein are all except. The options are overestimated gestational age, trisomies, fetal wastage, maternal diabetes, overestimated gestational age, intrauterine fetal demise, maternal obesity, or open neural tube defects. Now, in the previous class, I had told you that neural tube defects are of two types. Neural tube defects are of two types. One type of neural defects are the ones which are directly communicating with the amniotic fluid because they are not covered with skin, that are called as open neural tube defects. And the other ones are the ones which are closed neural tube defects, where though the fetus is having this type of neural defect, the amniotic fluid is not in contact with the neural tube defect. So here the amniotic fluid is in communication with the neural tube defect. So whenever there is an open neural tube defect, you know that the acetylcholine, the alpha fetoprotein is going to leak from the CSF and going to get mixed with amniotic fluid. When the alpha fetoprotein is going to get leaked from the open neural tube defect, it is going to have a direct communication with the amniotic fluid, and if you take the maternal serum alpha fetoprotein levels, that will going to be sky high. But in closed neural tube defects, there is no such communication between the fetus and the amniotic fluid. So the option D remains a straightforward option as the answer, that this situation is associated with increase in alpha fetoprotein levels and rest of the situations are associated with decrease in alpha fetoprotein levels. Now, when you talk about the conditions which are associated with elevated alpha fetoprotein levels, you will have hell lot of differential diagnosis. But when you talk about conditions which are associated with reduced maternal serum alpha fetoprotein levels, you will have very few to be remembered. So what are those? So overestimated gestational age, trisomies, fetal wastage, maternal diabetes, and maternal obesity. These are the 5 differential diagnoses which will be associated with reduced maternal serum alpha fetoprotein levels. You need not remember the hell lot of list which is showing elevated maternal serum alpha fetoprotein levels, because it is practically not possible to remember. But open neural tube defects are very well associated with increased levels of maternal serum alpha fetoprotein levels, and the reason why it is elevated I have already discussed with you. So this is in brief regarding the quadruple screen, the triple screen, the integrated test, the combined test, and also in brief regarding what is the inference of quad screen parameters in Down syndrome and Edwards syndrome, ultrasound markers of Down syndrome, as well as the conditions which are associated with abnormal levels of alpha fetoprotein levels. So I think this is it for the day. We'll meet you tomorrow with one more topic. Thank you.
Best training, peaceful environment, PG medical entrance exam preparation were my expectations. I got them at Speed Medical Village in Kanchipuram. Today, I am a PG topper.
Speed Medical Village, a unique eco-friendly campus dedicated for PG preparation. Speed Medical Institute, a complete solution for medical education.